Hello, everyone, and welcome. Today, we will be discussing surgery coding and some of the areas that you want to become familiar with. So my name is Instructor Bennett, and I will be your facilitator for this session. So as I stated, we're going to talk about surgery, which is a part of the integumentary system. So first, I want to give you some of the background rules for actually coding surgery. So one of the first things that you want to do is locate your surgery guidelines, which these are located at the beginning of the surgery section inside of your CPT manual. Inside of this section, this is where you're going to find all of your guidelines, and it will cover the services, what a surgical package is, what's included in a follow-up procedure, what is considered therapeutic, any supplies, also the reporting of more than one service. So you can have the surgery and then you can have a visit sometimes. You'll also have information about what is a separate procedure, an unlisted procedure, a special report, and imaging guidance. And then also it'll give you more information about surgical destruction. So as you're reading your chapters inside of your textbook, be sure to also review your actual coding manual alongside of it so that you're sure on how to apply these different concepts and then where they're actually located. So some of the services that are in the surgery section, you're going to code for, first of all, any type of procedure that the patient has, but then also you're going to have E&M visits as well. So if the patient goes to a specialist for a visit, it's not going to come out of the surgery section. It's going to come out of the E&M section, but these codes can also be built with surgery. So that's why they kind of mention it here. So even though their E&M is mainly for your visits, like your office visits, hospital visits, nursing home visits, so any type of visits, these patients can have those visits as well as a surgery as well. So that's why they kind of mention them. So that's why I like to kind of mention it as well. So when you're coding surgery, you're going to have what's called a surgical package. And in that package, what's going to be included is going to be services that are an integral part of that procedure. So this is going to include any cleansing that is done to the wound, shaving, and any prepping of the skin, any insertion of any intravenous access for medication. So sometimes the patient will receive some type of medication before the surgery. So that's going to be included. So any type of anesthesia, block that's either topical, those are going to be included. Any E&M service that's related to that surgery. Now, if it's related to the surgery, so if it's not related to the surgery, it's not going to be included. So just keep that in mind. Any post-op care, so when a patient comes in after they have their surgery, they'll have their follow-up visit. You're going to use an E&M code for that, for the follow-up visit. So this is what they mean when they talk about post-op care. So any documentation related to the physician orders regarding that post-op care, evaluation of the patient after they receive anesthesia. So all of that is going to be included in the surgery package. So you will not be able to bill separately for those services. So just, keep that in mind. So in your global package, which differs from the CPT surgery package, as far as in the definition, as far as in payments. So you'll get more into the payment side. So I'm not going to really get into that other than you'll just need to know whether the surgery is considered minor or major, because that could affect the global period. So usually the global period is going to be either no global period, 10 days for minor procedures, and then 90 days for anything that's major. So what they're saying is anything that's related to that diagnosis, that's related to that surgery, is going to be a part of that surgery package. So that means that you cannot bill any more for that service. So if that patient comes in, let's say they have a 90-day global period, and that patient is seen 3 times within that global period, but it's for the same thing related to that surgery, you cannot bill for that. Now, if it's for something different, then you can bill for that separate. But if it's during that global period, can't bill for it separate. So remember, minor surgeries are 0 days or 10 days, and then your major surgeries are going to be 90 days. So that's your global period where you can't bill for anything additional. So with the follow-up care, diagnostic procedures can be performed, and this is to evaluate the patient's condition, to see if anything changed, anything that's related to that diagnosis. So you want to be mainly focused on that diagnosis. That's what's going to be the determining factor. So if something is totally different diagnosis, then we know it's not going to be related to that follow-up care. So mainly focus on the diagnosis. That's to keep it simple. That's going to help you determine if it's related or not. So also in your follow-up care, like I mentioned, anything that happens between that global period, so if it's 90 or if it's 10 days, it's going to be included in that. Now, if you're going to bill for something that is unrelated, then you're going to have to put a modifier on there to say, insurance company, I know this patient got a surgery, but this is not related to that. So you'll put that modifier on there to notify them. So also what's usually going to be included is normal supplies that are related to that surgery. Those are going to be included in it. So any type of dressings, bandages, trays, things like that, those are going to be included in that global period. So you can't bill separately for those. So again, if it's something that's separate, it's normally going to have a different diagnosis. So that's going to be, that's going to be your clue, okay, that maybe I need to look further. Then you can have reporting for more than one procedure or services, and this is when a physician performs one or more services. You're going to add a modifier. So for example, if it's a procedure that was performed on the same day, you're going to need a modifier. A procedure that was performed during the same op period, procedures that were performed during a post-op. And then you'll notice inside of your CPT manual that you'll have codes that have a plus sign in front of it. What that means is that that is an add-on code. And your add-on codes are normally going to be found in your surgery section. So I have that plus sign in front of it to let you know that this is an add-on code and it should not be used by itself. So you'll see that plus sign. So now let's check and see if we have any questions about anything that I reviewed. So I don't see any questions now. What I want to show you is one other scenario that I would like to show you, and that is going to be the actual CPT manual and where you can find the information regarding the guidelines for each of the different sections. So as you're reading in your actual textbook, you'll notice that they'll talk about guidelines. So each section will have a guideline in it. It will just tell you things that's specifically related to that section. So that's where you're going to find those guidelines. I highly recommend that when you go from section to section, that you take the time to review those guidelines, because it's going to tell you exactly how you should be using those codes. So what I'm going to do now is I'm going to bring up and open, because I have a CPT manual that I can actually show you, just some things really quick on the screen. And it's not cooperating right now, so hopefully I can get it to work where I am able to share my screen, because I would like to show it to you so that you can actually see it. So when you actually are working in your actual CPT manuals, you'll know where to look and what I'm actually referencing. Okay, so I'm gonna actually share my screen with you. Okay, so my CPT manual may be a little bit different from yours, but they're all set up the same. I have this one that I have in an actual ebook, but the books are all set up the same. So we're talking about the surgery section. So I'm just going to come here and go to my surgery section. And at the beginning, you'll see the guidelines. So this is the guidelines for the surgery section. It's basically telling you this is the third section of your CPT manual. They talk about the global package here. So you have that information here. So you're reading it in your book, and then you also have it inside of your CPT manual as well. So it's going to talk to you about the global package, what's included, any special reports. It gives you information about that, about multiple procedures, how they should be listed. So this is the beginning section of the surgery section. It also talks to you about unlisted procedures. So you'll come across those as well. And then it'll go into the actual start going into the sections. So in your surgery section, these are the subsections here. So you'll start off with the general section, and then you'll go into the integumentary. And then it's broken down by all of your organ systems. And then you'll also have more information about image guidance. So even though it's in your book, kind of start having your actual manual open so that you can look at them both and compare what the book is telling you along with what's in your manual. Here are the modifiers that you can use in the surgery section. So your actual coding manual is going to give you a lot of information, as you'll see, even though you're reading it in the book as well. So talks about your add-on codes. You'll have that plus sign in front. So again, take some time to review the codes and then reviewing the guidelines for that section before you start. Like I said, each section will have guidelines that's specific to there. So they'll have, like you see in the middle of this one and starting the integumentary, it's going to talk to you about soft tissue maker placement with imaging guidance. And then it gives you some more information about how to use those codes. Here's your add-on code here with the plus symbol. So how this is going to work is you'll have to have the 10035 first, and then your 10036 for each additional lesion is going to be your add-on code. This cannot be used by itself. It has to be used in conjunction with the 10035. And so they have the notes here. This is why you should never code from the index, because if you code from the index, you won't be able to see this information, the additional information that they have. So just wanted to show you some of the things and how the book actually looks, and then versus what you're actually reading. So this is just a beginning overview about the surgery section, about integumentary. So take time, spend time with your coding manual as you're preparing, because the more familiar you are with your coding manual, the better you'll be prepared as you're going through and you're learning different things about coding. So that's all that I have. I don't see any questions. So if you have questions, please feel free to email me and I'll be more than happy to answer any questions that you may have. So thank you for joining and have a great day.